Hey, what's up? This is Dr. Lee, and in this video, I'm very excited to reveal the dangers and the truths about chronic disease and juice fasting. Is there a connection? What can we do to overcome these challenges? So there is a golden thread that is weaved across all these different chronic diseases. Now, chronic disease in America is rampant. It's on the rise. It's crazy. It's the most likely reason that you're going to die according to the statistics. So heart disease is at the top. Cancer is number 2. Lung disease is number 3. These are all chronic health conditions, chronic diseases. Diabetes is rampant like crazy in the world. A lot of times diabetes isn't the major cause of death, but it leads to complications that basically they're dying because of diabetes. So these are all chronic health conditions. Being a chiropractor, I see so many people with chronic spinal conditions, degenerative disc disease, arthritis, spinal decay, disc herniations, sciatica, headaches, numbness and tingling. These are all chronic health conditions that, guess what? They are not emergency situations. And if it's not an emergency situation, then medical doctors really have no business taking care of this because they have zero idea on what causes these issues to develop in the first place. They work around trying to label things. They'll take pictures, they'll do MRIs, they'll do CT scans, they'll do angiograms, they'll do all sorts of nuclear testing, they'll do blood assays, they'll do all sorts of different things only to come back and tell you that you have this label. And if you have this label, then guess what? This is a system that's devised by the drug companies and the insurance companies. Oh, you have this label, this diagnosis means that these are the types of treatment options that are available to you. So take drug A, B, or C, and then see what other drugs they're taking, and then cross off this one, take this. And it's just this algorithm of looking at your symptom, basically why are you labeling what's hurting, and then if it's puffy, swollen, or if there is some sort of a discharge that's coming out of it, or an exudate that's coming out of it, has the tissue hardened. It's all different ways of basically saying the same types of things, but you're not actually saying why did it happen in the first place. You're not ever actually getting to the root cause of it. You're labeling it so that you can give somebody a drug. Perfect system for the pharmaceutical companies to stay rich and then keep people unhealthy and not actually ever solve it. My caveat here, because that's just the way my brain works, is I never want to just 100% bash something without giving the other side of it, because there is a time and a place for medicine, and that is during emergency situations only. Short-term emergency situations, because people have gotten themselves into really, really, really bad trouble, and they need something that is going to stop them from dying within a very short window of time. That is where drugs and medicine and surgeries shine, is in that area. But is that the majority? Absolutely not. What happens is people are so sick and they're making these mistakes, and they don't even know what mistakes that they're making because they don't understand physiology. The doctors don't understand physiology. They're out there, they're smart on textbooks, I promise you that. But it's all towards a particular end, which is if you begin with the end in mind, and the end is going to be labeling something and giving somebody a drug or cutting something out of them, well, guess what? That's the way the entire profession and peer group within medical doctors, they think that way. And so you're going to be going down a slope that's ultimately going to end in a particular solution. The solution is not drugs. The solution is rarely surgery. The solution is going to be within you to figure out, okay? And so I'm going to explain something to you. If you have any type of a chronic disease, if you have an autoimmune disorder, if you have arthritis, if you have migraines, if you have TMJ issues, if you have digestive issues, if you have bowel syndrome like Crohn's, or you have ulcerative colitis, you have acid reflux, you have any digestive problems, pretty much any health condition under the sun, which is crazy, the cancers, all of it, all come down to like mistakes that we're making and misunderstandings of the body. So let's break it down. All of our body is made up of two fluids and a bunch of cells, right? Do you know what those two fluids are? So you got the blood, that's the first fluid, and then you have the fluid that bathes all the cells, the interstitial fluid. We can call that lymph fluid, the lymphatic system. 20% of the fluids are blood, 80% happens to be the fluids that bathes everything else, which is the lymphatic system. So the blood is think about the blood being the kitchen. The blood is what supplies nutrients that you eat. It gets into the bloodstream, and you take these fresh, wholesome ingredients into the body, into the cells, so that the cells, which are what create all the function in the body, are there to survive and to do their job and to function and to work, right? You got to have fuel. You got to supply them with fuel. You also need oxygen to do that. So when you breathe through your lungs, it gets into the blood. So guess what the blood is doing? It's providing the nutrition. So it's oxygen. It is the food and the minerals and everything that you need is all coming in through the blood. So the blood is the kitchen serving up the meal to the cells. And that's why you got blood that goes throughout everywhere. Well, once the cells eat the food that they just had, and they use it to do work, to create energy inside of them, then once they're done, guess what? Just like a car engine, it has to spit out exhaust. Well, that exhaust inside of the cell is waste products, right? So these are metabolites. These are things that are like different products that get broken down, and now your body has to discharge it and has to get out. So every cell is basically like a mini organism, right? It's pretty amazing how our body is kind of built in fractals. So like something small represents the whole, and something in the whole is also represented in the small little tiny units. So a cell is like basically an organism all by itself, and so it eats, it has to poop. We eat as a big organism, it has to poop, and it trickles down. So blood brings nutrition in, crank. Then the cells have to get the exhaust out, it has to poop. But guess what? The cells can't go to the bathroom like we can, sit down on a toilet and do their business. Or, yeah, don't have to get any more graphic than that. What the cells do is they stay put. And they just push their waste out into the fluid, not the blood. They push it out into the other fluid, the second fluid, that 80% of our body is made up of, which is the lymphatic fluid, the interstitial fluid, the extracellular fluid. For those of you who are more well-versed in anatomy and who understand physiology a little bit better, these are all the same types of fluid, right? It's whenever you pop a pimple and you see barely a little bit of blood, but what comes out? This white, nasty stuff, and then you see clear fluid that, the more you pinch it, there's more clear fluid that's coming out. That's the interstitial fluid. Okay, that's not the blood, right? You don't just have blood gushing out of every pimple that you have. It's usually this clear fluid or this viscous stuff. And that is your interstitial fluid. That's what most of us is. We're this big bag of water, basically, right? Water and cells, and then there's some blood in there. So that is our bathroom system. That's our septic system. That is our means of getting rid of waste. Now, that waste has to then get into that system, into the lymphatic system, and then it gets channeled and it gets taken to the kidneys to be dumped out. Now, this is where the science has it backwards. Anatomy hasn't figured out this gap because they're making a huge mistake here. They're not understanding that the ends that they're looking at, they don't even really understand the lymphatic system. They don't see it as a very important system. So there's been very little research on the lymphatic system, and everything is all about the blood. I mean, gosh, like every study under the sun has something to do with the blood, but almost nothing has to do with the lymphatic system, because in science we have in anatomy they've kind of screwed this whole thing up, and they've made a fatal assumption, and the assumption is that you are going to they know that the lymphatic system deals with like drainage and junk and crap. the idea is that it ultimately gets all pumped back into the blood, and then the blood is then filtered and excreted. This is the silliest thing possible, because the waste that comes out of the cells is at a 3 pH. That's hot. That is super, super hot. And if it's really, really, really hot, then what that's going to do is that's going to start to damage the tissues. The lymphatics actually buffers that. But if the lymphatic system just kicks that back into the blood, guess what happens? You're gonna damage the blood. You're gonna taint the blood. The blood vessels aren't even made to deal with that level of pH, like nothing even close. In fact, the lymph nodes, so if you get swollen lymph nodes when you're sick under your throat, you got lymph nodes all throughout your body. Their job is to change that pH of the waste products from being very, very acidic. Battery acid is like a 1 pH. Stomach acid is at a 2. We're talking a 3 pH. Normal pH of the cells is right around 7. So we're talking logarithmic changes here. So we're talking, like 1,000,000 times hotter than the blood when we're talking about the pH. But the pH goes from a 3 back up to a 6. What that does is that makes it way less hot. It cools it off to where now the body can start to actually push it out through the kidneys, the lymphatic system through the kidneys. But medical system has got it wrong because they don't understand the lymphatic system. They don't understand how it works. So what they think happens is that all of this waste winds up going right back into the blood. Why would you take a dump in your blood? Why would you go take a poop in the kitchen? You're not going to do that. The kitchen has to be kept pure. That's the delivery truck for the nutrition that is going to your body. That's your oxygen. That's your nutrients. And there's also like hormone messengers and stuff that'll use the blood as well. But that is your clean highway. You have everything else that is inside of your body doesn't get filtered back into the blood. It goes out. If people don't understand this, right? If medicine hasn't wrapped their head around this concept, which you think they would, but they don't care about it because they don't think that that it matters. There's some people who believe that this has actually been covered up, because if this understanding is understood in medicine, it unravels everything. So possibly, there possibly this information is covered up because there's no incentive, because there's no drugs at this point that are going to fix these chronic health conditions. So they'd rather people and doctors not know the truth, and so they want to keep this information outside of mainstream medicine. And to be honest with you, this information is outside of even the alternative space. This is very poorly understood by any healthcare practitioner, period. I was floored when I learned about it myself, because I was like, holy crap, this makes so much sense. How do we not all know this? Like it makes sense at such a core fundamental level that it changes your whole perception. So if you're not following this totally, let me see if I can clear this up as we move forward. Don't stress about it. What we have to do is we have to make sure that your body can clear out the waste. Okay, stop focusing on the blood. Blood doesn't matter. Blood matters. In this case, it matters less than the other thing. Okay, so we gotta clean out the lymphatic system. Let the lymphatic system drain, because here's the problem: we're not actually draining our lymphatic system. It's backing up. We take all these toxins in, we eat the wrong foods, we are poisoned by pesticides and chemicals, and processing our food, cooking our food changes the chemical structure and winds up turning it toxic inside of our body, believe it or not, which is freaking mind-blowing to me. And it winds up then clogging things up. And we get clogged up, and we keep pouring more and more and more chemicals into our body, more and more and more damaging agents. More toxicity starts to get built up in the system, and our body just gets clogged up more and more. It's trying to unclog itself. It's trying to get the waste out. And if it can't get it out through the kidneys, guess what it does? It starts to come out through the skin. Do you know how many dermatologists are just making an absolute fortune off of people? dermatology is a hot field right now because so many people have skin disorders. Skin cancer is everywhere. Weird sort of lesions. I mean, look at Dr. Pimple Popper. Like, why is that so popular? I mean, there people have an interest in the morbid stuff, but and it is pretty interesting to see something nasty come out of people. But this is a field that is just crazy popular. Lotions, potions, rub this on your skin. Makeup companies making a fortune covering up all of the skin problems that people are having, and just and it's so universal that we don't even question it. But our skin is a detox organ. It's a secondary detox organ. It's not supposed to be our primary. If you ever hit the can hard, you drank heavy the night before, you wake up in the morning, you reek in your skin. You can smell it, right? You can walk into a room of people who have been drinking and are hungover that day, and you can just their whole room smells nasty. You can smell it. It's very, very clear. Where is that coming from? It's coming from the skin. Skin is coming off the breath. It's coming out of the mucous membranes and literally inside of the mucosa. Your eyes, any mucous membrane is a detox organ if it has to be. It's not primary, it doesn't want to be, but it'll do it if it has to. Your nose, if your nose starts running, guess what? That's stuff that's draining out. That's your body saying, we got to get the lymphatic fluid out. We got to get the nasty stuff out. We're going to get it out. Your ears, there's holes there. You have waxy, sebaceous fluid and secretions that start coming out whenever you start to get sick. You can have ear infections that start to back up, and they have to drain into your throat. And if that swells up and that doesn't work, then you start to get an ear infection if it can't drain well. People have stuff coming out of their belly buttons, vaginal discharge, constipation, diarrhea, nasty stuff coming out of the bum. So there's different ways that the body goes about trying to get stuff out, and it will do so at all costs. But when your kidneys get backed up, that's peeing. Kidneys are what allow you to urinate and pee stuff out. And most people, their kidneys are functioning so poorly that they're not even filtering, and they're peeing more clear. And this is another misconception, a huge misconception. I was taught it as well. Is that you should be peeing clear. If you're drinking enough water, you'll be peeing clear. You really don't want to be peeing clear because most likely you're very toxic. You want to see color in your urine. You want to see that. I mean, you should be peeing often so you're not dehydrated, but you should be having color in your urine. You should also be having sediment in your urine. So if you capture your urine, put it in a jar, seal it off, look at it a few hours later, there should be sediment, like a little bit of sediment at the bottom if you're filtering well. And this is all backwards, right? We look at that as like, oh no, sediment's just a thing that can happen, occasionally. We're not really going to discuss why, like, who knows? Like, it's just more of like an abnormal finding, but we don't ascribe it to any serious problems because there is no problem with it. That's your body functioning well. So medicine, they look at it and they say, well, check the box, for urinalysis. Check the box if if there's sediment in the urine. Well, what does that mean? I don't really know. And that's really the answer. I don't really know. Talk to pathologists. What does it mean if there's sediment in the urine, but the patient is pretty fine? It's just a normal variant. No big deal. They don't know because that's normal. It's supposed to be that way. And instead, they're so used to people being abnormal that they think that is normal. So your kidneys are supposed to be filtering. If they're not filtering, it goes to the skin. If the skin's not filtering, it goes into all the mucous membranes, and you start just getting it out through any hole necessary, and that starts backing up. And then you also have your colon that can be a shunt. And so that gets us to the solid food vacation. When you are detoxing on nothing but juices, guess what? You start to empty out your colon. All the nasty impacted fecal matter and waste starts coming out of your body. When it starts coming out of your body, then now you actually open up a new channel of elimination where your body can actually take lymphatic system, because you got a big lymphatic network all around your digestive tract, and you can actually start a reverse retrograde flow of stuff that's inside your lymphatic system, and it can get pushed out through the cells into the stomach, and you actually create a shunt, dumping toxicity into your colon to get stuff out. And that only happens primarily whenever things are pretty solid, right? That can be fasting or a juice fast. When if I said solid, I don't know why I said solid. I meant not solid. You don't have anything inside there. You have an empty tube basically with nothing but liquids in there. And you now start drawing other stuff in. You know how things go from a high pressure concentration to a low pressure concentration. That's the law of diffusion. What happens is that's what happens here is you go from a high concentration of solutes inside of the lymphatic fluid, and then it will get pushed into an area of lesser concentration because your body actually pushes that out and it gets the junk out. And that is what we want. We want to accelerate this process because it's probably been decades and decades that this toxicity is built up inside of you, and it can't just flip the switch and it's all out in a few days or a few weeks. All right, this can take months and this can take years in order to detoxify yourself, because guess what? You have other pollutants that are coming in as well that are still adding to your toxicity that your body has to get out as well. So you're not living in a perfect bubble where all you're doing is detoxing. You're not putting anything bad into your body, because if you're breathing the air, you're still getting some sort of pollution in there that your body is now seeing as an insult, some sort of a toxicity that your body has to deal with. So all that being said is that we have to get your body eliminating. That is going to be the first step. This conversation that I'm having with you right now could literally be an 8-hour lecture very, 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 very easily, which is challenging for me because I can be long-winded when I get excited about things, because there's so many things to talk about here that just changes the entire paradigm of health and your understanding of it when you have chronic disease. But the first thing that you have to understand is the importance of going on a solid food vacation, doing a juice fast, so that you can start to create that shunt effect to get the toxicity starting to flow out of your body, so you can get the lymphatic, the stagnated lymph fluid that has been built up with all these acid wastes and the cells that are literally constipated and congested because they don't want to start kicking stuff around because they know they're just going to toxify their own environment. They don't want to do that. So they hold on to the waste. And so you have all these cells holding on to years and years of toxicity and waste because it's more dangerous for them to spew it around the other cells around them. They're trying to protect their neighbors. They don't want to do that. And what happens is if that starts if that system is allowed to open back up, then you can start to flush the waste out. And when you start flushing the waste out, the cells now can start to function the way that they're supposed to again. And all disease comes down to abnormal cell function. I'll repeat that. All disease comes down to altered cell function, abnormal cell function. Cancer, abnormal cell function. Diabetes, abnormal cell function of the beta cells of the pancreas. Or you can look at there's just so many different diseases. Like literally every disease comes down to it. You look at cirrhosis of the liver, where the liver is a fatty liver, abnormal cell function. You have kidney failure. Kidney failure is a poor functioning kidney because the cells in the kidney aren't doing their job. You look at heart disease. Heart disease is going to be poor functioning of the heart. It's not working the way that it's supposed to. There's many different factors involved. The blood vessels, so small blood vessel disease. It's going to be the problems within the cell wall of the blood vessels themselves. Like, so the cells that make up the blood vessels that are impacted and they're inflamed and they're starting to get hard and sclerotic. You have multiple sclerosis, which is different patches that start showing up in the brain. So you're getting abnormal tissue in this central nervous system. Parkinson's, you're having any of the neurodegenerative diseases inside of the brain. These are they're finding that it lays down plaque, like beta amyloid plaque, tau proteins inside of the brain. Even after concussion or head trauma, why do some people start to lay down plaquing inside of the brain? It's because the cells are damaged and now they can't kick out the waste, and so they start building these different proteins inside of the brain. These things are all connected to abnormal cell function, whether it's a nerve cell, it's a heart cell, it's a kidney cell, it's a liver cell. It's a skin cell. These cells function poorly, they're going to cause disease. And then we just look at it and we try to label it as doctors and then give you a medication based on what we just labeled that for. And it's like, oh yeah, the skin on your retina is, or the retina itself is, we're seeing abnormal cells in there. So this is a retinopathy. Sounds like a crazy thing. It just means that there's a problem in the retina. Well, what caused the problem? Well, we don't know. It's associated with diabetes. Well, what caused the diabetes? Well, it's probably from the foods that you're eating. Oh, really? So foods that you're eating. Well, it could be genetic too. Well, what caused the genetic problem? What caused that? Well, you got it from your mom. Well, where'd she get it from? Her mom. Or where'd she get it from? At some point, there had to have been an impetus to start this stuff, you see? And this is where medicine just starts to chase its tail, and they don't even stop to think about it because they go, oh, no, you got a problem with your vision. Well, it's because you have diabetes, and now cataracts are very common, and so that's just part of the nature. It's the diabetes that caused the cataracts. And it's like, well, that's true, but what caused the diabetes? Like we never stop and actually think about this from a more like holistic level, that there has to be some tipping off point where this all starts. Where does it start? It starts by making mistakes in what we're consuming, and the toxicity starts to build. And as we continue making those mistakes, we'll never heal. We're never going to heal. So going on a solid food vacation, you stop making the 5 main mistakes. And when you stop making those 5 main mistakes, now your body can actually start going through the normal function that it's supposed to have. And that normal function is going to be to excrete the waste. Okay, and that's what we consider that to be detox, like we're doing something, like the juices are somehow doing something to create a detox. They're not doing anything to create a detox. If you see people selling detox supplements and this and that, they're not anything that's there to actually like, kind of like a drug. Everyone just wants like the magic fix. So, oh wait, I don't have to change anything with my diet. I can just take these pills and I'll detox. You're detoxing no matter what. How well you're doing it is going to be dependent on how much you're poisoning yourself by the choices of foods that you're intaking inside of your body, and the amount of toxicity that's already inside of your gut, and how backed up that is, how much organ damage you might already have. And that has to all be factored into the equation on how do you get out of the situation that you're in, right? If your kidneys are shot, you're not filtering them. Well, guess what? It's going to be challenging for you to overcome things if that organ itself is failing to the point where that's the thing that was going to save you, and now it's shot. What do you do then? What if you have like a bunch of your colon removed, and that's how we're going to start getting stuff out, right? That's an eliminative organ that you're just cutting out because there's been problems and medicine didn't know what the hell to do. So they're like, well, damn, let's just take it out. I had my tonsils taken out. My tonsils are a lymphatic tissue. They were constantly getting swollen up. I had a lot of health problems when I was a child. My parents tried to make the best decision for me, and at the time it seemed like, hey, let's take out the tonsils because that's what swells up, and it seems to make sense because I couldn't swallow food very easily. So it's like, well, let's stop the thing that's obstructing him from being able to swallow food so he can start putting on weight and starting to thrive more, make sure he's getting his nutrition in. And so they went through the surgery, and sure enough, yeah, I was able to swallow food, but guess what? That's my ability to cleanse my head. So the head has to drain into the lymphoid tissue, which is the tonsils and the adenoids, and that takes the acid, converts it to something that the body can process and kick out. So guess what started to happen to me after I got my tonsils removed? Instead of having sore throats and strep throat all the time, I started having severe headaches all the time. Guess what? Not draining my head. The toxicity that I was continuing to consume that was really the problem, by making the five main mistakes, I was continuing to toxify my head and not being able to now detox because they just took out detox organs here out of my throat. And now that's starting to back up, and now that's starting to cause problems. And so I went on an escapade of 10 years of having like chronic headaches before thankfully I started getting regular chiropractic care, and that actually started to open up like how my nervous system was communicating, which actually starts to allow the detox to kick in as well. and starting to now improve that ability to detoxify my body, as well as opening up the lymphatics, the neurolymphatics that are starting to show up in the spine. So I was very, very, very fortunate to, you know, not continue suffering, because this became my path in life to help other people to experience the same thing. And we can stop this at its source. If you have chronic diseases, doesn't matter where at and what tissues, if it's congested and it's backing up and it's getting toxic, you have to fix that. You absolutely have to fix that. There's no ifs, ands, or buts. Everything will come back unless you fix that. If you keep making a mistake, guess what? You will keep having the problems that that mistake led to. Doesn't matter. You can do a surgery. Guess what? Like me, take this out. Now this problem starts hurting. Oh, gallbladder. Oh, my gallbladder ruptured. Well, that or having gallbladder attack. I see that all the time with my patients. They get their gallbladder removed and it's like, oh, the pain went away. Guess what? I can keep doing what I'm doing. I can eat the crappy food still. They're like, but it doesn't seem the same. And all of a sudden, next thing they know, a few years down the road, they have way worse problems. Something much more substantial starts to show up, and their body continues to fall apart. And now it's way worse. And now it's way, way worse because they've literally kind of bypassed some sort of a major alarm bell, and they kept pushing forward. And this will destroy your body. This will destroy your health. And so you have to stop making these mistakes. Going on a solid food vacation is the first step to the solution of getting your body back, getting your health back, cleaning these tissues out. Stop putting the junk in and allowing stuff to now actually start coming out. And that's what you're going to see. You're going to see stuff starting to come out of you that you've never seen before. Things that are coming out of you that you had no idea were inside of you, don't know where they've been kept, and it will come out with a vengeance. So I want you to watch my other videos to see like what sort of things that looks like. But I really wanted to go into this to talk about, like, you know, what are the dangers of not doing a juice fast? What is the dangers of keep doing what you're doing, continuing to go to the doctors that you're going to, continuing to take the medications and toxic drugs, and ignoring the actual problem that you may be reluctant to actually tackle, and you have to make that change if you're ever going to see your health shift and change. Because guess what? The easy solutions didn't fix it, right? Where you didn't have to alter your lifestyle at all. I'm sorry, I'm here to tell you, you're gonna have to alter your lifestyle, and it's actually not that hard. It becomes very, very easy. You know what's super hard is suffering and having surgeries and being basically being X'd on the sidelines of life, when you should be being able to thrive and enjoy yourself, being able to enjoy your contribution to society, being able to enjoy your family, your spouse, your kids, your friends, being able to go out and do the things, explore. If you like exploring, explore this beautiful world. We want to be able to see all these things. So that is going to be my charge to you, is to jump on this, do a solid food vacation, get excited about it, because this is going to change your life in a way that you have no idea. And I'm so excited for you to go on this, and I'm so pumped up, because when you do this, as my friend John Rose says, you are in for a treat.